Imagine a tiny cluster of cells, barely visible, holding the potential for a human life. When does that potential earn moral consideration, and how do we make deeply personal decisions about its future, especially within the sensitive world of assisted reproductive technologies? Weighing embryo status in the ethics of assisted reproductive technologies, often abbreviated as a RT, is profoundly complex because there is no single, universally accepted answer to when an embryo gains moral status. This ethical challenge sits at the intersection of science, philosophy, theology, and personal values, leading to a spectrum of viewpoints on its inherent worth and rights. The core of this debate lies in determining when an embryo achieves a moral status deserving of protection, similar to that of a born person. Some perspectives hold that full moral status begins at conception, viewing the embryo as a human person from its earliest moments. Other views propose a gradual acquisition of moral status, perhaps after implantation in the uterus, the development of a nervous system, the emergence of sentience, or even later. Scientifically, milestones like gastrulation, the formation of the 3 primary germ layers, around 14 days post-fertilization, are sometimes cited because, after this point, the embryo cannot divide into identical twins. These different understandings directly impact ethical considerations, guiding principles like beneficence, which considers the potential for life, and non-maleficence, which seeks to avoid harm to that potential life. Given this wide range of beliefs, navigating embryo status in practical RT settings involves careful consideration of individual patient values, clinical guidelines, and institutional policies. Healthcare providers and ethics committees work to facilitate shared decision-making, ensuring that patients are fully informed about the various ethical perspectives and their implications for embryo creation, storage, and disposition. Legal frameworks also play a role, providing a societal baseline for certain practices, though these laws vary significantly across different regions. An important element in this discussion is pre-implantation genetic testing, or PGT, a process where embryos are screened for genetic conditions before implantation. PGT adds another layer of ethical consideration, as it involves selecting embryos based on their genetic makeup, prompting questions about what constitutes a desirable life and the implications of such selections. Additionally, the principle of reproductive liberty, which emphasizes an individual's right to make decisions about their own reproductive life, acts as a crucial guiding force in these ethically charged decisions. Ultimately, effectively weighing embryo status in a RT ethics means engaging in open, empathetic dialogue that respects diverse perspectives, integrates scientific understanding with deeply held moral beliefs, and supports individuals in making choices that align with their personal values regarding life and family.